So I would now introduce our final speaker, and there is a phone here that is going off.
Sorry, that was my timer.
Professor Luigi Fontana is a director of the University of Sydney's Charles Perkins Centre RPA Health for Life program and works to promote healthy lifestyles across New South Wales, addressing both individual health and environmental sustainability for a better future. Luigi believes most chronic diseases are preventable, which I think the evidence supports, and advocates for a prevention-focused health approach. Thanks, Luigi. Look forward to your presentation, Professor.
So good morning. Very, very interesting speakers and concepts. And as you can see, there is a lot of determinants of health. So it's a very complicated issue, but we need to do something because, as you know, chronic diseases are basically responsible for over 90% of the burden of disease, not only in Australia, everywhere in US. And the problem is that, as a doctor, I'm coming from the biology of aging. As you heard, health span, these are the numbers. If you look, the numbers are 29% of our children in Australia, 8 to 11, overweight or obese. Age 25 to 34 is 58%. Men, age 45 to 54, 83%. And if you look at, basically the overweight, the waist circumference, the numbers are appalling, as you can see, close to basically 90% of people aged 65 to 74, they have an increased waist circumference leading to multiple chronic disease, including diabetes, fatty liver disease, and cardiovascular disease, cancers. So the picture is really bad for the sustainability of healthcare system. There is no doubt about it. As you can see here, this is, again, Australian data. As we age, the number of people with one or two more conditions is basically exponentially increasing, going up to basically almost 90% having at least one chronic disease or two. And we know, based on the Treasury International Report data, that by 2062, the cost of healthcare is going to triple, meaning that most of the budget of the New South Wales is going to be for healthcare, for sick care. Let's call it with its name, sick care system. Okay? And these are the most common diseases. The total expenditure, we have musculoskeletal disorders, back pain, neck pain, hip and knee, has to do with lifestyle, bad posture, overweight, cardiovascular disease, cancer, mental disorders, and then many others. And that's the most important slide. This is the summary of the research we did in the last 30 years when I was working in US at Washington University St. Louis, and I was leading the Healthy Longevity Program. Many of the common chronic disease we see in our hospital, they share a common metabolic molecular substrate. Of course, if I have prostate cancer, I want to be treated by the best prostate surgeon and the best oncologist. I don't want to be treated by someone who is working on lung cancer. So if you develop the disease, of course, you want to have the best doctor specialist. But in reality, if we act on the green factors, so the lifestyle, we can prevent most of the common chronic diseases. The World Health Organization claims that at least 80% of cardiovascular disease, diabetes, and obesity are preventable, and at least 40% of cancer are preventable. My data, based on my research, 30 years research on healthy longevity, suggests that it's more than 80%. Probably it's close to 95% of cardiovascular disease, diabetes, and probably 70% of the most common cancer. But anyway, just to give an example, because I don't have time, to go into the details, just an example. Here, we take men and women 50 to 60 years old, BMI 25 to 30. This is a study we did when it was in US. We randomized them to exercise calorie restriction. They lost 8% of their body weight over a year. And by the way, exercise only was able to reduce body weight by 8% because these people that were exercising 1 hour a day, 6 days a week, at 72% of max heart rate. So exercise, it works if it's a daily medicine. It's not just, twice a week. And by MRI, we got a 40% reduction in visceral fat. The visceral fat is really the bad fat that is causing all this hypertension, diabetes, cardiovascular disease, cancer through multiple mechanisms. 40% in 1 year, both with calorie restriction and exercise, and had major improvement in glucose and insulin sensitivity. Why is important insulin? Because what we publish in Science is that one of the key aging factor that is causing the accumulation of damage in every single cells of your body is hyperinsulinemia. So if you have excess belly fat, you are producing more insulin. It's called compensatory hyperinsulinemia, and you are driving one of the most important aging pathway that is causing damage to every single cell of your body, causing all these multiple chronic diseases. And this is another study we did, where just with a tiny 13% reduction in caloric intake with optimal nutrition, we got a super physiological improvement in all cardiometabolic risk factors. Cardiovascular disease is still the first cause of death, morbidity, and burden. Major improvement, these are where people 30 to 50 years old, slightly overweight, major improvement. So the benefits are huge, and 1 year, 2 years, you have massive improvements in cardiometabolic health. As we heard in these several talks, we typically concentrate on diet, exercise, quality of diet. They are very important. We know mechanistically more and more how we can target specific molecular pathways in way that we can prevent diseases by having a mechanistic approach, not just the 5-2 diet, the keto diet, the paleo diet. This is kind of, religious fad diets. We know mechanistically, but what we don't do very well is on the mild health, emotional health. We have heard about, the importance of spiritual health, emotional health. There are other factors, social factors, environmental factor, economic factors. So it's a very complex picture that is addressing these metabolic molecular factors. And we need an holistic approach, but it has to be based on science, on mechanisms. And another important point, aging doesn't start when you are 65. Aging starts in utero, before. What you do before you procreate is epigenetically changing for 3 generations the predisposition to develop multiple chronic disease. Of course, I agree with you, there are all the other social factors, but also epigenetically, you can change based on what you eat, what you do, what you think, the propensity of your kids and grandkids to develop chronic diseases. And therefore, with changing your lifestyle and your social determinants, you can accelerate the accumulation of damage, or you can decelerate the accumulation of damage, and you can change the slope at any age. That's what we have shown in multiple trials. Okay, so it's never too late. So just to end, how many minutes I have left?
7 minutes.
Okay,
Wow.
good. So this is important because the question is, okay, now what we're going to do? Based, we have this beautiful data now, randomized clinical trial, molecular data, understanding how we age, what are the important pathways. So when I started medicine in Italy, I graduated in 1994 and started to do my residency in internal medicine. I was going to the ward, and you had this patient with heart failure coming in. You treat them, send back home. After a few months, they come back, say, I cannot do this job. I want to understand how we can keep people healthy. How we can we keep people healthy? And the answer is yes. We know that, for example, dietary restriction without malnutrition can extend lifespan and health span by 50% in animal models. And my study in US and humans are adapting to these interventions as long-lived animals do, and the answer is yes. And we have, in the last 20 years, dissected, the molecular pathways. Now, the next step is how can we translate that? So last year, I met Kevin Chang, who is a GP, is also a consultant for many, many companies, who got $10 million from a philanthropist, a friend of him, And he started this experiment, it's called the Osana experiment, in Woollahra and lower North Sydney. 6,000 patients. Instead of doing the classical fee-for-service primary care, he said, let's do a value-based. So basically, these are the three pillars: preventive medical care, so risk stratification, proactive health assessment, chronic disease checklist, planning and review, slow medicine, more time with less patients, longitudinal care with a care team, multidisciplinary team case conference, clinician on salary, including GPs. Point two, patient activation, so patient membership, subscription, health assistance support, including at home, goal setting, health coaching, lifestyle programs, so practical diet, cooking, nutrition, exercise, share medical appointments, community groups and health education, and social prescribing, and then use the technology, data science, gamification, clinical dashboards, scrubbing of notes to identify care gaps, and all this beautiful stuff. So I don't have the time, to go into the detail, but, I want to give you this number and discuss this number with you. So the major finding of this trial, that this was not a randomized clinical trial, that's why, I'm hoping I can raise funding to repeat this experiment with a real randomized clinical trial model with economists and everybody, so we can really look at the numbers. But anyway, this study, 3 years, 6,000 patients, suggests a 51% reduction in hospitalization with this value-based model of primary health care. 51. So we are talking about billions of dollars that can be used to what we discussed this morning, to subsidize healthy food, exercise, people who are in demand, because they have issues of poverty. And so that's the only way, to transfer all these sick care money into something that can help nutrition, exercise, mental health, spirituality, community, because, without community, who cares, to live long, if you are lonely, you don't have friends, you don't have, the social support, and it's maybe, crazy, but I think, we can really, if we are able to demonstrate that, we can save a huge amount of money by doing, and to be honest, in these 3 years, they didn't do what we think, with Woo Win Kim. She's a young doctor working with me. I'm the director of the Charles Perkins Center RPA Clinic and Health for Life program at the University of Sydney. And for example, we started to work in schools with Woo Win. We are trying to work with Sydney girls and girls to start to the education in schools. Because believe it or not, in 2025, my kid is going to Mosman High, and his friends, they are telling him, what is your proteins? For them, protein is animal proteins. They want to become big in gym, eating a lot of proteins, a lot of junk. They have no understanding of these mechanisms. So how can we expect to change the society if in schools we are not teaching? In medical school, we are not teaching. I'm doing 2 hours in medical school at University of Sydney. All the rest is diagnosis and treatment with drugs and surgery, mostly, okay? So how can we transform the society if we don't start from the education? So explaining basically not just eat more fruits and vegetables and exercise. What happens when you exercise? What are the mechanisms? When you eat, what happens, to the gut microbiota, the fiber, the body fat, what happens with the hormones. So we have to explain mechanisms, not just dogmas, exercise and eat more fruits and vegetables, don't eat junk. And then, we have to change the primary health care. And I hope that, we can work together with Eugene and everybody to try to say there is a different model. This model is not working, is unsustainable, is sick. There is a lot of inequality. The inequality is growing by the day, so it's not sustainable. We need a different model, a different thinking, more holistic, more integrated, and we have the data. We have the data showing that it's feasible, and that's what we are trying to do with the limited resources, with my group at University of Sydney, at Charles Perkins Center. But definitely, this is a much bigger project that needs multiple actors working together to change and transform our society from from treating chronic disease to promoting chronic health. Yes, we can promote chronic health, and that's what we need to do. Thank you.
Thank you. Thanks so much, Professor Fontana. That was really insightful. I don't know if anyone saw Dr. Gabor Mate when he was here last week. And one of the things he said that really stuck with me was often what's written on someone's obituary is what actually caused their death. And that is, in their obituary we might write, oh, they worked so hard, they gave so much, and really it links back to the stress, and the overworking and the stress prevents us from being able to focus on our lifestyles and our communities. And often that stress and overwork is a trauma response, in effect, a desire to try and prove ourselves. And so, not just the primary health model focused on helping people to have those healthy lifestyles, but as you said, really helping them to have their spiritual health and focus on their community so that we can address some of those emotional causes that are then influencing, people's choices of how they live their lives. So that's great. Thank you so much.